Latino who grew up uninsured and knowing what it's like to live one illness away from the poorhouse and parents worrying about their kids' health, to remove that from the families, it's removing a major stressor amongst the people in our community, and that's a positive. So this is Mr. Martinez. There are a lot of brand new patients to our practice, so there's a lot of pent-up demand. Some of them already knew they had diabetes or high blood pressure, they just couldn't find the means of getting it treated. Others never went to screening, so they didn't know that they were walking around with high blood pressure. And how about the breathing?
I've been fine since the medication hit.
Good. Okay. In the net, I'm really excited by ACA. It's just removed that financial barrier for so many of our patients. And for practices like ours, where we had the commitment to serve our fair share of the uninsured, it makes the task of the remaining uninsured a lot easier. The number of uninsured patients has been cut almost in half. So we're actually down to about 4% of our practice is uninsured because they've been able to access Medi-Cal expansion and also covered California. I'll be right back. I grew up here in the East Los Angeles area in the city of Commerce. My dad and my mom were both workers in the service industry. My dad was a busboy all his life, and my mom was a hotel maid. And so very typical immigrant family, we were growing up uninsured. And it's really interesting, for 2 years my dad had a job at a restaurant that had organized labor. So for 2 years we actually had Kaiser insurance. And then I got pneumonia during the time that we were covered by Kaiser. So we were very fortunate to have access to healthcare, where in Mexico, where I was born, a child with pneumonia is almost a death sentence. 90% of our patients are Latino, yeah. In part, it's the communities where we practice, and in part because we're mostly Latinos in the group. And the reason we practice in these communities is because we grew up, we're very connected to them. We understand the needs, and we understand that everyone should do their fair share.
Okay, vamos a ver aquí la espalda.
Some of the barriers we saw and that we experienced with our own patient population has been the concern about immigration status. They have mixed immigration status many times. Fortunately, neither we nor Covered California is playing the role of ICE agents. So it's important for them to know that these are not agencies that are going to share that information with ICE. We haven't yet had to turn people away, but at some point we're going to need to close our panels because there is a huge demand for services, especially in communities like East Los Angeles.